to the Rooted Connections podcast.
Hi.
Thank you for riding with us. We're super grateful that you've taken the time to be here again with us. So the Rooted Connections podcast is where we talk about everything life, everything about our culture, everything about our roots, hence the name Rooted Connections, and actually how that connects us, together. And I'm here today with my one and only.
Hey. Hi, everyone. My name is Uju.
Oh, I forgot to say, my name is Pam.
At this stage.
I know.
At this stage.
They should know now. You should know by now, guys. It's Pam and Uju.
Hi.
Hi.
If you're new here, welcome. We're glad to have you. And
Yes.
if you've been rocking with us, welcome back.
Welcome, everyone. So today is another very, very special episode. We have our lovely, beautiful, intelligent, delectable. I don't even know, I can keep going. Many, many adjectives. One of our sisters. We have many sisters.
We do.
We have many, pool of sisters, 5 sisters. Unfortunately, they're all taken. So we're not advertising this one. But we got our lovely Michelle in the house. Woo-hoo!
Welcome.
Thank you.
I don't even know where to start with this introduction. Michelle is somebody who I really and truly admire. I know I don't get to tell you that a lot, but I do. We've known each other now, I don't even know, at least I'll say minimum 15 years or more.
At least.
At least 15 years. And one of the things I actually find quite fascinating about you, Michelle, is just how grounded you are.
Absolutely.
As in, honestly, you're one of the very few people who, I don't think I've ever heard you raise your voice, but you're firm. So it's really, you don't mess about. So when it comes to things that you don't agree with, I've never heard you like shout or or like me that when I get annoyed, I start to get animated. No, I've never heard you be like that. And you're somebody who genuinely is a joy to be around, and thank you so much for being here today. I'll let you do the formal introduction and why we decided to have you on our podcast. If you just want to give us a bit of an introduction about who you are, what you do, and just a general intro about you.
Wow. Thank you, Pam. That was quite an introduction, honestly. Like, you've not even ever told me any of these things.
No, I haven't. So now you know.
Brought me online.
Don't use it.
You brought me online and came to flatter me. I like it. So where do I start? So obviously, my name's Michelle. I am, first and foremost, I am a child of God. That is me through and through.
Yeah.
And if we go in the hierarchy of things, then that is me. And obviously I'm married with 2 children and my family. And I'm so blessed to have them, really. They're kind of like the gift that God's really given me in my life. Career-wise, and I think that's part of what we're going to talk about today. I'm a consultant paediatrician. So I look after children and I work acutely, which means I don't work in the community. I work in hospitals, so it's hospital-based work. And my area of interest is high dependency. So that is almost like a level before children get to intensive care units. So when they're really unwell, but sometimes needing to move on to intensive care, sometimes not. So not just children who are admitted, but they're admitted and they're a bit more unwell and there's a bit of a worry about them.
Okay.
That is me in a nutshell.
You see what I was saying?
Fabulous.
You see? So thank you so much for being here. We'll definitely go into it, but would you?
Yeah, so our tradition here, we usually start with a question to kind of break the ice and, get ourselves talking and get our audience to know you a little bit. So my question for you today is, what qualities do you most value in your friends?
Wow, that's quite a tough question, isn't it? Seeing that you guys are my friends as well, so I have to be a bit careful. Really.
Do I have
See
why I flattered you first?
So, was that your plan?
Yes, no. Because I had seen the question, so I was setting the mood.
So that it's not me that's we. You see, this girl is not nice.
Everywhere.
Michelle, answer the question, please.
So I think it's a hard question, and I think maybe it's more dependent on the stage of life you're in. Because I think when we were younger, we probably valued different things.
Yeah.
Maybe our core might have always been the same, but you probably value different things in the friends because friendship maybe meant a little bit different when you were younger. But for me now, I think I just want people who are genuine.
Yeah.
So I am not about, if you like one thing and it doesn't kind of sit with me, it's still okay. I'm not kind of like, we must all be same mindset, doing the same thing. I think core values are important. So, I have friends who are from lots of different backgrounds, different religions and everything. So, but it's the core values, I think, and just kind of being honest, being genuine. And people who are generally kind of maybe not so self-absorbed. I can't hang around people who are self-absorbed. It really, that's the one thing. So if you're genuine, you're honest, and I can just see who you are, that for me is fine. And I can relate to that because if you put up a certain front and then I get to know that, but then start to see different shades of you coming out, I really can't deal with that. That's something I can't deal with.
Yeah.
So I think, just being genuine, coming up front with who you are. And I think both of you guys are exactly like that. And many other people. But honestly, you are who you are and there's no airs. And I don't have to feel like, I have to be a certain way because I'm around Pam or because I'm around Uju, I have to be a certain way. And I think that's what I appreciate anyway.
Yeah, absolutely.
Yeah.
That's a fantastic answer, to be honest. And you say it is, even thinking about it from my perspective, is very much what you've just said. I need people who are real and that I can be real with.
Yeah.
And it's, and if I would add anything to that is, I think for this stage of life is people who, not necessarily that our views align, but our core values align.
Yeah.
Because I want people around me that if I am messing up,
can be honest.
They would see it as, this girl, you are messing up and set me straight.
Yeah.
Because if your core values or your morality is very different to mine, you will allow me do whatever.
Yeah, that's true.
And at this stage, I really don't need people like that around me. And more importantly, we have children now. They are looking at our friends as well.
100%.
You know what I mean? So it's kind of the people that I allow in my space. I want my children to be able to also look at them and see a good example. It's not like, but Mommy, why did you tell me not to do this? Uncle this is always doing that. Or Auntie that is always doing that. So for me, I'm a bit mindful of that now.
I think if I've answered the question, I don't know if there's anything more to add. But if I'll add anything, I think for me, what I would, and maybe it's probably aligned to some of what you've already said, is I think right now I need friends who add value to me, to every area of my life. And I think that's one of the things we've said, I think on the podcast, is maybe there's this thing about when you hit 40 and there's just no capacity for nonsense.
Yeah, that's true.
Because there's so much going on in your life. I think right now, I can say for all of us, we're at the peak of, and I don't actually, not necessarily peak, but we're doing a lot. You're parenting, you're managing a home, you're working. So if you have friends that, if I don't call you throughout the week, it's not because I don't care about you, but actually you can pick up the phone and say, Pam, I haven't heard from you. How are you?
Okay.
Are you okay? And that for me means a lot, because it's not because, and I don't need needy friends.
But equally, is that ability to even just pick up where you've left off, isn't it? So we appreciate that we're all busy. Like, you and I were joking that, you don't text back, you don't do this. But actually, you're not holding a grudge because you've not heard from somebody.
There's no grudge.
Yeah.
And, it's also managing expectations and understanding where you are in your life right now. Absolutely. And giving you that grace, because that's something that not many people do. And for me, that's what I find valuable in friendships, because like you said, is that we can all, how many times we'll probably not see in a long time, because all of you decided to live in a village away from me, and I still hold that grudge. But,
stopping you.
Please be quiet. And then, now when we then eventually all meet up, that we can all have a good laugh. We can all, it's just like you said, being yourself around each other and not even having to worry about things coming out of my mouth. I have to be worried. How is that going to land for you? How's that? Do you know how many people, how am I supposed to be managing that? Please.
Yeah, that's true.
You know, and I think there's something to say for, you know, having people that, you know, that even if, you know, it all goes wrong for you.
Oh, yeah.
They will
That's
still
so.
be there.
The village.
Yeah. So for context, what Pam was referring to, Michelle and I live in the same village. So she's an essential part of my tribe. Essential.
Wicked people.
It's something really valuable. I don't think a lot of people have that. I think a lot of people have friends where it's dependent on how they show up, how they relate, and all of that. So I think that is definitely something unique. You know, and we shouldn't take that for granted, really.
No, at all.
Yeah, absolutely.
Yeah.
Right. So on to our conversation for today, guys. So we're going to be talking to Michelle about her journey. She's told us where she's at now as a consultant. So I think maybe we'll start with the question of why. Why did you pick medicine? You know, because it's one of those that as children, including me, I said I was going to be a doctor.
Yeah.
I did.
I never crossed my mind.
It crossed my mind.
I hated science.
It crossed my mind.
Crossed my mind.
It was the day my older brother's friend who was studying medicine came to the house. I was talking about his, you know, and he mentioned cadaver. I said, sorry, I don't understand. You mean it's a real person? He said yes. My brother was like, how else do you think you're going to learn how to, you know, about the human body if you don't? I was like, right. So that's where it ended for me.
Okay.
That's where my own ended. But I mean, because it is such a tough, you know, profession to actually get into. So why did you pick medicine, and how did you, you know, stay motivated to actually get to where you are first off?
Okay, so why medicine? So I guess I think I had that natural affinity. So, you know, the thing that you heard cadaver you didn't like, I was always interested in that kind of stuff. So that was my thing. I quite liked anything medical. I'd watch all the medical shows, things that were gory, not like horror, but actually real life stuff. So it was stuff that I enjoyed. And then I also liked the sciences, chemistry and biology particularly, which is what chemistry actually, surprisingly, is what you need to get into medicine or used to. So I quite liked it. And then I thought, what will I do? I kind of naturally just drifted in that direction because of what I enjoyed. I didn't have any kind of role models that were doctors. My parents were not doctors, aren't doctors. And nobody actually, even coming from an African sort of background, nobody said,
be my question, actually.
Are you going to be a doctor? Do you need to be a doctor?
Yeah.
Career was not even a thing that was really spoken about in my household. It was just, nobody even said career. It was just,
fair,
everyone did what they enjoyed. Yeah.
Wow.
Your mom is not the average African.
No, she's not. So we kind of, so I just drifted into that. Did my A-levels. Well, it was actually not A-levels I did an equivalent of A-levels called International Baccalaureate. So it gives you 6 subjects and gives you a broader it's supposed to give you a broader outlook on life. So you do your core subjects, which would be your sciences or whatever you want to choose. And then you add some extra things. They want you to do humanities. They want you to serve the community. So things that will broaden your outlook. So I did that in 6th form. And then applied for med school kind of as a natural kind of this is where I was going. And I don't know whether that was just God directing me or just me kind of flowing in that direction. And when I was applying for med school, you have to do lots of research. You have to, because there's interviews that come up and things. And I really just enjoyed knowing more about the thing that I was going to be interviewed on or the places I was going to go. And I think I did a course as well for people who wanted to go into medicine. It was in Nottingham, I think. I came and did like a weekend, and I really just enjoyed everything about medicine. Wow. It was just like that. So and then I just entered med school, found some good friends who were also medics, and we just used to roll together, go to lectures. And each time I never felt like, gosh, this is a burden, because some people dropped out and that's because you get there and it's not what you like or what you can handle. So people dropped out, but you know, and I wasn't like in med school, I wasn't maybe top of the year. I just, I'd party as I needed to party, enjoy life with my friends. And then I'll buckle down and work hard for exams and make it.
As you do.
And as you do, make it. At least I was there for a reason. So fulfill that reason.
You had a balanced...
I tried to have a balanced time. You know, there were some people who were very much kind of book focused. Those are kind of, you know, maybe the people that go on to be surgeons or something. But, you know, I just quite enjoyed it, really. And then it just kind of progressed.
From there.
Oh, fantastic.
From there, yeah.
It's interesting.
You know, we'll come back to that, or maybe on a different discussion, your family dynamic, because, you know, the typical African household is doctor, lawyer, accountant, engineer. That the fact that you weren't put under that pressure, but you still ended up there is, you know, it's a conversation to be had, you know, because I think we put unnecessary, I'm digressing a little bit now, but sometimes we put all this pressure on children, whereas if you just let them be, they will come to their own and surprise you and get to, you know, a fulfilling end.
Yeah.
And I think just to add to that though, there needs to be guidance as well.
Absolutely.
Because obviously leaving a child to their devices, they'll tell you that you hear all kinds of interesting discussions.
Yeah.
But I think ultimately, to Drew's point, because I wouldn't necessarily, you know, I think victim is not the right word, but I was that child who from secondary school, my dad had told me what I was going to. So very much everything was aligned to becoming a lawyer. There was no, the tribe I'm from in Nigeria, if you know a little bit about this, Ishekiri people, when it comes to law and land, that is like, in fact, throw a stone in that community will hit at least 10 lawyers. So for my dad, it was so important that, you know, because he didn't get to do university like that. So for him, his first child has to be a lawyer. And so that was very much my trajectory. And I just hated it. Even though I did it, I have 2 degrees in it. I just hated it.
Yeah, so that's interesting because I thought you did law because it was something you liked.
No, I wanted to do media. Interestingly, that was what I wanted to do.
See, that's why that
was what I wanted to do. Media was very much my interest. I did a lot of things that, in hindsight, if I had been allowed to do what I wanted to do, or if that sort of more broader understand had opportunities that had been given to me to explore that, I think I would have done a lot better in that media space. Yes, I think. But anyway, as we just said, let's not, that's a whole nother conversation. A whole nother discussion. Funny enough, we did, you know, we still talk about it now. We have a laugh about it. And he's like, actually, I didn't know. But, you know, no grudges held.
You can look back and have a laugh about it.
Yeah.
No, but I think also it led you to where you are now.
It has.
Isn't it? Because you did the law and then you did the human rights law, which then led you to social work, which is where you are now. But I told her she owes her father's school fees money.
I do.
Yeah, so
she owed, because how many degrees?
How many degrees that I still came back
add
here?
It all and refund
I would have finished this thing ages ago.
So that's your excuse for not
I don't
paying
owe him.
back.
He owes me.
Oh, he owes you.
Yes, he owes me. Exactly.
Daddy say I'm siding you. She owes you.
But anyway, so now talking, let's go a bit deeper now into the why, you know. And I like the fact that you had the genuine interest, because that's sometimes what is lacking, is that we do certain things because we want to please. But, you know, from what you've said, it's something that the passion just grew naturally for you. So, and, you know, stating the obvious, you're a Black woman. You started off very young. And from what we know with sort of those sort of career pathways, it can get challenging when it gets to where, you know, at first it's all well doing, it's hunky-dory, but I suppose it gets to a point where the pinch starts to, you know, you start to feel that pinch and the pinch isn't coming because it's hard. There are systems in place that is making it harder. So would you say that that's something that you experienced on your journey? Because now you're a consultant, well done. But even in getting there, what would you say were some of the challenges that you experienced?
So, yeah, I guess there's 2 things, right? So one is obviously being a person of color. And then the second is being a woman. And so when you put the 2 together, that already, I think, generally puts you quite far down the chain, if you like, isn't it?
Yeah.
Although having said that, the way I was brought up, and I don't know whether it's the same for you guys as well, but I think the way I was brought up, color wasn't really an issue when I was growing up. And that part of that was because part of my upbringing was in Ghana. So we're all pretty much the same color. And there's no kind of, race isn't a thing really. But then my stepdad is also white. So I grew up in a household that was kind of mixed in color. But that wasn't a thing that ever really stood out. So I think for me, I used to say to people that actually I go around through all of these maybe predominantly white spaces, not realizing that if I zoomed out, I'd be the odd one out, the one that's standing out. Yeah. So I just get into the space and I just do what I'm supposed to do in the space. So color wasn't a thing that kind of played on my mind, and has maybe become more so as I progressed. I've become more aware of that. And I think that's also because I've been progressing in a different environment, but also my knowledge of things are kind of growing and changing. So in training, I think I started off maybe naively, just, putting my head down, doing the stuff, turning up to work and stuff. But I definitely did realize that, and it might be cultural as well, being from an African background, is that, number one, people who I guess were Caucasian but male seem to gel better when so we would rotate. You do a few months in a specialty, then you do a few months. So you move around a lot. Yeah. But it took me longer to kind of settle into each rotation.
Right. Yeah.
And you'd find that people who, number one, male, I think the men kind of seem to just get in there and settle in. Particularly, you often have to get on with the nurses wherever you go. So if you're on a ward, the nurses are, you have to get them on your side to be able to get any work done. But the men would easily do that. They would get in and quite easily do that. Despite color, I think. And then comes if you're kind of similar color, similar kind of views, similar interests, then it's a lot easier. So I remember one particular rotation, I used to think, we would all come into the ward together. And there was this other guy who, Caucasian male or white male, and we're all the same. We didn't have any experience in that particular specialty. And it was a very hard specialty. It was very tough. And the people there were not forgiving, as in the team were not forgiving. But he'd come in, have coffee with the consultant team, be chatting to them. And, I went climbing here, so-and-so over the weekend. And my wife did this and that. And I would just be quiet. And, I just come and sit there quietly, which is coffee time. I'd just be sitting there quietly, respecting myself, And I think those are one of the challenges, I think, whether we place it on ourselves or whether the environment also doesn't help, because I don't think at any one point did the individual, the other individual ever say, oh, Michelle, what about you? Include you in the conversation. So you just sit there on the side, like you're not seen, not visible, and you just kind of feel, and it's quite, you do walk away feeling, what's the word? You kind of, you just feel a bit down when you come out of that space. But for me, I just thought, whatever, my work will prove its worth. And that's the way I look at it. Yes. I think, well, that's fine. I know that when I put my head down and I keep going, at the end of the day, it proves its worth. And that's how I've always approached stuff. So, those things grate me. But then I think actually, at the end of the day, when I do the stuff compared to this person that, is blagging, we'll see the worth in it. But that is some of the challenges. And, some of that is us having that ability to speak out and feeling like we can and join in the conversation, because we don't feel we quite belong. We feel like we're on the margins.
Yes, 100%.
But there is that thing for whoever's holding that position of authority in that space to actually welcome you into the space. And that's the bit, I think, that has been the challenge, has really been the challenge. And sometimes even having progressed in my career, being more senior, you see that, you might be in a meeting or something and you give a comment and then it just feels like, was my microphone not working on Teams or, has nobody actually heard this comment? Do you know what I mean?
I totally.
And somebody gives a very, not really anything to write home about. And then there's lots of responses and stuff. So you do get that. And I never really carried the racist card because it wasn't the way I viewed life, but I have become more conscious of it. But I still don't let that kind of
define you.
I don't let that define me, but also don't let that kind of stop me.
Yeah.
And it actually makes me work harder, want to work harder to show that actually it's in the work that I do, you'll see it come out.
Yeah.
So yeah.
That's a great answer. And actually I can totally relate to that. And because of that particular point that you made within my role, because of how I started off training as a social worker and some of the experiences that I had, very much what you're saying in terms of especially that training, when you start the training in anything, just how unseen, unheard, and then even when you dare to speak, how you're viewed. And it's very much shaped me in terms of coming into practice. And just on the point you're talking about recently, I had a situation where in court, a solicitor was on my case. We were two social workers working on a particular with two different families, but it was like a conjoined case. And the solicitor for my children would totally ignore me and be asking the other social worker, who's white, questions about my case. And it happened on a couple of occasions. And when it happened again, I've gotten to the point where I feel really confident to speak and I don't really care anymore. So I had to, I said, sorry, she's not the social worker. It's me. Because every time you've had to ask her a question, the question then gets directed to me. So you're actually wasting time speaking to her about my case. And I actually raised it with the local authority solicitor. And I said, look, this is not on. Just because I know that there's a chance that I'm going to probably bump into, because it's such a small space, in Leicester, I'll probably bump into her again just for her learning. Yeah. Can you please tell her that it's not on? Yeah.
And I guess it's that kind of subconscious, is it racism maybe?
Yeah.
Because it's a bias.
It's a subconscious bias that you're not going to be that person
competent enough to,
or that person has seniority over you just because. I think the worst one is, like in meetings where, to your point, you raise a point, it gets ignored, so to speak, and then somebody else, usually a guy, says the same thing you just said, and they'll go, "Oh, such a wonderful idea,
brilliant
and you're
point."
Like,
yeah,
I've argued this. I literally just said this to you.
Yeah.
So there is good leaders notice those things, and it's not just about, I think, representation, 100%, that's where it comes in, because people who have experienced it, you're on the lookout for it. So I can't be in a meeting where somebody says something and somebody else says, and everybody goes, yeah, that's a good point. So I'm like, yeah, that's the same point this person made. So I've done that in meetings before. I'm like, yeah, that's the same point this person made. And I think it's a very good point.
Yeah.
And you see, for us now, and like you said, your experiences has given you the confidence to be able to speak. Not very many people have that confidence to speak. And one of the things I really feel is needed and valued, but I don't think whether or not it will ever get there, is creating safe spaces within workspaces for people to be able to genuinely feel able to share, just because of how it's received and has rebuffed. And many times, a lot of things play into that: religion, culture, race, all of those things play into it. Because somebody who has a funny accent, for example, might say something to the point you're raising, the same point, but maybe they have an Indian accent. And somebody who has a white, because they, I can hear,
tuned in.
For me, I can relate to your accent better than I can relate to this person who has an Indian accent. Unfortunately, and for some of us, then we have to learn code switching. We have to learn code switching, because you have to sound a certain way to be seen and accepted, and that's, within those spaces.
That's another point. But I think, just to go back a little bit before we move on, about creating the safe spaces, it kind of starts with us as well. Like what Uju was saying, we have to do that for people. And I try and do it for anybody, regardless of your race or whatever.
Absolutely.
So if I'm leading a team, like if we're going around, for example, an award round, I'll always, to be fair, introduce the junior doctor that's with me, rather than just walk in and say, I'm so and so and do this. I always introduce myself, and then I introduce the junior doctor as well. Or if they're sitting with me in a clinic, I'll always introduce them, or student nurse, or whoever's turned up to kind of shadow the clinic. And I think that's quite important, so that that person feels like they've got value.
Yeah.
They're in that space for something, you know. And often, like the other thing you were saying as well, I've often will go around with junior members of the team, and then people will address them. Right? They'll speak to them. I might start off with the question. So how do you think your daughter is doing? How do you think your son's doing? And then they'll just look at that individual and
be direct to the question.
And to be fair, I don't even get stressed about it now, because again, it comes back to the same of knowing who you are.
Absolutely.
So I know ultimately you can talk to that person all you want, but at the end of the day, if you want your answer,
You have to come
where
back
are you
to
going to come to? That person is probably now going, oh crap, what does this person want me to do here, you know? And then you can see them getting all nervous because this person is addressing everything at them. And I'm not, because it's all about being comfortable in as who you are in your own self.
Yeah.
Because you know that person, even in court, that person still has to, other one's not going to hopefully answer on your behalf.
Yeah.
So they have to come to you at the end of the day. So you just wait for it to happen. You wait, or if it doesn't happen, you just take control of the situation and finish it off. And, you know, then they come to realize it. So, yeah.
Oh, brilliant. So I think, on this career matter, that I think is, we can go on and on. But I think particularly though, one of the things that we want to get out of this episode as well is, and we've touched on this a bit with another guest, in terms of the acceptance of diagnosis, being within that space where you're making decisions and sharing, you know, diagnosis. From what you've said, this is
Sometimes
what you
tough
do, and it's hard, but sometimes you have to tell parents the hard truth about something that's wrong with their child. Have you found it particularly challenging with sort of Black African, and I say Black African because that's what we can relate to, because of our cultural views, our spirituality, the way that we view things? Have you had to share diagnosis? You don't have to obviously go into detail, but just share diagnosis with a family where they've really struggled to accept it, not because it's not true, but because of the lens, the cultural lens that they're viewing it
have
from.
they refused the line of treatment based on a cultural or religious perception?
So I think, first of all, culturally, there's always, what is the word? So people kind of lean into what they know, don't they? And then everything else, unless they've built a level of trust, is kind of, for them, it's almost like they have to defend their culture or their belief against that thing. So people are already coming from that viewpoint. And they do that in every environment. So when they come into the hospital, is no different. And it's even in very simple things. So you're talking about, you're talking about things like difficult diagnosis, but sometimes it's the very simple things, like literally, you know, the reason your child is doing X and Y is because their iron level is low, because they're not eating, you know, certain foods, and we just need to supplement it. Sometimes it's as simple as that. But in their mind, if somebody presents a certain way, is there not something else? Is there something, you know, they have a different kind of viewpoint, and to bring them to that is tricky sometimes. And often, because I am of Black African descent, clearly, I try my best to, I don't want to kind of say, oh, we're all the same and I know what you're feeling. I don't approach it like that. I kind of give them the facts as I would any person. But then if I see that there is resistance, I then try and approach it from the point of view that I do understand that, you know, you may not see it that way because of X, Y, and Z. But I wouldn't tell you this unless I believed it to be true. So I kind of try and like align myself with them so that you kind of build an element of trust. I think with all patients and their families, you have to build trust anyway to be able to get them to engage with what you're doing. But particularly if they are, and I think seeing that I'm also of the same color usually gives them some confidence, because sometimes I might come on the ward and everyone has maybe said the same thing. But then I come and then say, I get that, you're worried that this is going to happen. And it comes from both culture and religion as well. You'll find Black African Christians who are saying, no, because, I don't want this. I don't accept this for my child. It can't be like this. And I'm like, listen, I get that. This is the diagnosis. And I know that you believe in God. And I know that God works in different ways. But it doesn't mean that this is not true.
The reality, yeah.
Yeah, it doesn't mean that that's not the reality. And we know that, God is above all of these things. And I always say that to them. You know that God is above all of these things. But there's a reason that we're here, and there is a reason. I've said to one mom who, came about, and was talking about how she'd been praying and whether all of this, what did I think? Is this really like what they're saying? Is that true? And I always say, there's a reason that, I am here, I'm a Christian, I'm a doctor, I'm here for a reason. And there might be a particular reason why we are here today having this discussion. So, we have to see this as beyond, that God is bigger than all of this and not kind of shoehorn him or box him into our thoughts. So that's how I usually try and approach it. It's difficult. I must say it's really difficult because some people are just very, and let me say we as Black Africans, we don't trust very easily, particularly in the health sector, because there's always a feeling like there's some agenda and people are hiding something. And I try and explain that, in this society, in this setting, we actually don't hide anything from parents, whereas back home, it may be that the doctor might tell you a little bit, but actually won't tell you everything. But we don't hide anything. So whatever we're telling you is really actually what it is. We're not saying, it's this, your child's got constipation because they've got tummy pain. We're not just saying constipation so you feel good and we're hiding that something bad is happening in their tummy, but actually they really do have constipation and that's all you need to do. So there's always that feeling that there's some hidden agenda or something else that people are not telling them. And it is very tricky. It's really tricky. And, while we all come from the same background, maybe same religious view or faith view, people are still individuals. So, you don't know that person anywhere at the end of the day. So it's quite difficult. So I try and form a rapport as much as I can and then try and understand their point and then say, look, this is what's going to happen. Particularly sometimes when there are long-term illnesses as well. If it's a long-term illness, and they're saying, why is this thing still, and Africans, it's like, we also want to rush things a lot. There's no acceptance for anything that is long-term.
That's it's
true. Like, why can this thing not just go away? Please. Why is this not going? Why is it? And I'm like, listen,
it's complete degeneration.
There is a process. And then sometimes I try and give them, context where this has happened and they've successfully come out, they've been fine. But this is the current process and just be patient, take time, be patient, but we just want it sorted. We want it yesterday.
I mean, it might even be in things like lifelong diagnosis that, there's no cure for this, but this is how it needs to be managed. Because we've had a discussion about my daughter, right? About her diagnosis of vertigo. Recently.
Yes.
And you were telling me off because I think she was prescribed some medication. I read up on it. It's like, Michelle, I don't
she can't drink it.
There you go. See?
Why does she have to have
one of them?
I know. Why does she
them.
need to have it twice a day? Can't she just have it once a day? Like, no, it's prescribed as twice a day for a reason.
Just give it.
Oh God! So now funny enough, your voice is in my head because now every day I'm not saying I've been religious with it, but because the morning routine is that she has all her medications before. Yeah. So bedtime, I'm tired. But when I remember, I do give it. As I'm better.
But sometimes it's like you say, it's also explaining, because often people say, okay, I'm going to give you this thing, take it twice a day. This is what you need. Go off. But sometimes it's taking the time to explain to them that the reason you have to do X, Y, and Z is because if you don't do it, and I've explained that. So for example, just for confidentiality reasons, I won't be too specific, but we've had like some children, for example, born preterm, and that takes time. It takes time for the baby to start to feed on their own. It takes time for the baby to do things. And I've had, a parent saying, what's all this about not giving them food? I'm just going to give them. I'll give them some. I'm like, no. This is the reason, because this child is not ready. And if you put this thing in their mouth, they're going to choke. They might actually, it'll go the wrong way into their lungs, and they're going to be in a worse off position. But people don't take that time to explain that, really. They just say, well, this mom's very difficult, or this mother is very difficult. And sometimes it's just taking that time, because I already know where they're coming from in their mind. Yeah. But yeah.
So I think the key thing that I'm hearing from this conversation as well is the importance of representation. Because, you know, if you are, in fact, what am I saying? My second daughter, the consultant that did the CS was a Nigerian lady. And when she came in and said to me, look, this is the option, this is where we're going. It's an emergency section because of XYZ. There was a comfort. I didn't question it. You know, it's not what I came for. It's not what I had in mind. My first my first delivery was like by the book, textbook. You could say at this point this will happen. And this was the complete opposite. But this is a Nigerian lady, and when she said to me, "This is the only option," I didn't even think that, you know, sometimes you think, oh, this person is just being trigger happy. They just want to do this. But for her to tell me, this is where we have to go, I'm like, I just assumed in my mind that she has done every other thing that I would have done.
Yeah.
And it's probably, a white doctor would have probably got to the same position. Don't get me wrong. I don't think her race mattered at all. But
for you,
the
it gave
user,
you confidence. Yeah.
Absolutely. There were some things she was telling me off for sure. Just like when I refused to have the epidural immediately, said to me, "There's no award for not."
You see, but she can confidently say that because she knows what you will relate to.
Absolutely,
yeah.
I was like, I had to now explain to her like, no, that's not that's not where we're going with this. that I'm all for the medicine, but it was she could go straight there because of the cultural context. Somebody else would not, and if very well that was my issue that I was trying to do, I want to deliver like Hebrew women.
She's spoken to that,
straight away. She had cut that, like, look, that's not what is going on here. And so there is 100% value in representation. But there's something as well you touched on at the end there, where you say that people can just assume this parent is just being difficult because they don't understand where this mom or dad is coming from. I think I've even seen it in court as well. You know, I remember there was this dad who came in, he's a Black British guy, and he was stating his case on why he sees children. And when we got into retiring, this woman said, one of the people I was sitting with, that, oh, the way he's coming across is controlling. I was like, no, it's not. He's not being controlling. This man has not seen his children for a long time, and he's trying to state a passionate case. But I could see it as passionate because I'm used to our passion.
Animated.
We are very animated, you get. So I'm used, and he wasn't even overly animated. That's the funny thing. He was just very straight, very direct with what he wants. So I'm like, I don't think so. This is not a controlling situation. That he's unrepresented. He doesn't have a lawyer. He's trying to state his case as best as he can. This is just a father's passion. How is it controlling?
And then you have to factor in, he might even be nervous. He might be fearful that this is the end of his, parental rights or whatever, isn't it? But that doesn't get looked at.
No.
And there's a thing about, obviously, tone of voice as Black people generally. So tone of voice, because we've come from places where you have to shout for somebody to hear you. The cars are buzzing, there's horns going, you have to shout. It's not an environment where we're quiet. So I think that's the thing that
fits into it.
That's the thing, isn't it? The tone of voice and the passion. We gesticulate a lot as well when we're talking. We use our hands a lot, and it's not. That's culturally a bit different to here. So that gets misconstrued, I think. And that comes...
You get that view of you're coming across aggressive.
Aggressive, yeah. And then that comes to your point you made earlier of code switching. That's when you then have to code switch, because you have to start reading the room and go, if I start throwing my hands about and talking loud, are these people actually going to hear the content of what I'm saying, or just see me as a Black woman that is just a bit much? Yeah. So, yeah.
Yeah, okay. So to that point then, have you ever found yourself in a situation where you've identified a lack of cultural awareness in how... So of course, the diagnosis is diagnosis. We're not saying that. And the treatment is the treatment, right? But sometimes, like we've identified, there is a lack of trust. There's a lack of,
connection, so to say.
Acceptance, because it's hard for me to accept that you're telling me this is happening to my child. So rather than seeing it that, because sometimes they can even raise it as a safeguarding concern.
Oh, yeah.
That this parent is not accepting. So social services need to get involved. And I'm sure there have been loads of situations like that. But, for somebody like you who gets it, have you had to step in to say, actually, guys, maybe we need to approach it from a different perspective, because it's not that this parent does not love the child, but there are certain factors or, certain things at play here that we need to look a bit different that might change the room.
Yeah. Yeah, no, I've had to. And, from a safeguarding perspective, because we deal with safeguarding as well in the hospitals, one of the jobs we do quite regularly. We do see that. We see that. So when I was training, actually, and this isn't about the cultural acceptance, but it was when I was training and I was working in the community, community pediatrics, they do a lot of safeguarding referrals. And so every week, at the end of the week, we'll have a meeting and go through all the cases. So there was somebody who had a photo, and they had a story about query child abuse or, a non-accidental injury. And the photo they put was of a black child's hand, and it was their knuckles. And our knuckles are quite dark.
Oh, gosh.
So it was whether that was bruising. Oh. So, and there was a concern there that they'd been bruised. So in that meeting, I actually had to say, look, that's normal. And look at my own hands, because that is a normal part.
You're talking,
but that's not something people actually are aware of, that your skin is brown, but your knuckles are black. So that's one thing. So, and in current days, we've had that in safeguarding as well, where some things are cultural practices, which comes to, and you might have spoken about this maybe in one of your podcasts maybe, but the cultural practices that really people need to be aware of not to do in the UK.
Absolutely.
But they do because of naivety, because of this is how it's always done. And then that becomes a safeguarding problem because they've done some stuff. And I'm not talking about things that are illegal. So like female genital mutilation and stuff, that's definitely illegal. But these are things that there's no legal kind of framework about, but it's stuff that people do culturally. And I don't want to be specific, so it's not obvious the things I'm talking about, but we might do it back home and we might do it to a child or to a baby or something. And then that gets picked up, and then that's a safeguarding issue. So sometimes it's to bring that context to say, from this background, this is how people do things. And they're not necessarily aware, but now we need to make them aware that this is not what we do here. So it's it's bringing that kind of voice sometimes. And it's difficult because, I've trained here and I've worked in the system. So there's a bit of a conflict sometimes of both, because what I don't also want to do is to condone things that are not right.
Absolutely. Yeah.
And I don't want to be the person that's just the kind of warring for all Black people that come, it has to be that it's necessary and it's deserved. So I will only speak out if I see that actually it's going in the wrong direction. Otherwise, I let people do their work and do what they need to do. I can't interfere in everybody's work as, hey, because they're Black and they're doing this or whatever. I just leave it to them. But if I see that this is going to have some severe consequences, whether for the parents, whether for the child, then I might speak up in that context.
I'm laughing because when you were saying I won't give specific examples, I'll just give one. And it's for me, it was quite funny. So there was somebody was sharing with me how a health visitor came to, the first visit after you leave the hospital. Mother-in-law.
Oh, yeah. It's always the mother-in-law. It's always.
Mother-in-law is there giving at the time the health visitor turned up, mother-in-law is giving the baby a bath.
Dear.
And you know how they usually say, in fact, sir, first of all, you're not supposed to give the baby a bath every day, but we don't. I'm sorry.
And even usually in the first few days, they'll say just give them a top to toe. Don't
bath my children.
Yeah.
But this one was, the whole traditional stretching the baby out. So she, and even the poor mom didn't know there was anything the issue with it, because this is a cultural thing, isn't it? So the health visitor was like, oh, where is the baby? Oh, she's off, quite happily took the health visitor up to see
the bathing process.
She's at the point where she's
twisting
the baby, and how they hold the baby like this. So she made a referral. She made a referral, but luckily they were able to, the mom was able to explain that, obviously with a bit of education, that look, this can cause, this and this, please just be aware of this. But it could have that child could have been taken away straight away.
Yep.
Do you understand? But again, it depends on who the referral lands, because some people don't have the time. When you read the referral, no. You're not deserving of this child.
No, exactly. Exactly.
So yeah, I just remember that story. I thought to share.
Exactly. And that's a whole topic on its own about, I think you did that kind of people who migrate here.
Yes.
Yeah.
I don't want to say the word because I don't know how to do the bah. But, that is a whole topic about those kind of things. Is realizing those things that you just do not. You just don't do. It's just not done.
It's wrong.
Yeah.
Yeah.
That bathing was the one when you said you don't want to give specifics, that's exactly the example that came to mind, And the way some children will even be crying when they are doing that bath, it can look so cruel. Okay, so for me, I want to circle back to where we started with. When you did your introduction, you said you're a child of God.
Mm-hmm.
So my question then is, how does that play or factor in practice on your day-to-day? Because I will certainly speak for myself, when you get to that point where you're questioning with Christianity and all of that. So I think we all get through that journey. And one of the questions that I always, that I never really am able to answer fully is, that God, you're such a good God, but why do children have to suffer certain things? These are innocent babies. I think the other day I was, going through, there was that passage where they were asking Jesus, who sinned, this man or his parents, for him to
be the way
he is, So there is this human instinct to always feel like there is a cause of, for something. But you get to see, as you said, you work with, like, in acute cases, the suffering of the children going through really terrible illnesses. So how do you balance and still, treating these children and still maintaining your faith?
Yeah. So the way I look at it, and this isn't because I've always been like that. I think I've grown in my career and grown in my faith and done that simultaneously.
Okay.
So the way I look at it is when I'm going into work, I am going there as a hand of God, as a servant of God. So, I used to kind of just go there and just be like, okay, if something bad happens, then I'm praying at the time. But now I'm going there more intentionally. And that's what I do now. I'm going into work intentionally, asking God to use me where I need to be used. And actually to help me to be somebody that brings healing in whatever the form of healing is. Because I used to think that's just making that person better. Okay. But actually the healing now is not just for my patient, but it could be for the staff, it could be for the parents. It's healing for whoever I encounter and whatever form that comes in. So, while I've studied a craft and I'm there to deliver that, and, when I'm in resus mode, this child's unwell, I'm bam, 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 bam. And I don't take prisoners. I don't want to hear X, Y, and Z. I want us to get the job done. So I will do that. But within that as well, I have like a background mind that I'm just praying in that same time. And I'm praying for God to it's not just your will be done. Yes, definitely, because God's will is the ultimate.
Oh, absolutely.
Yeah.
But it's about, God be present in this situation, take charge of this situation. So because of that, if it doesn't go wrong, I'm not kind of blasé about it, because we're emotional people. So I have cried when, children have passed away. Often you will cry because it's sad and you've invested everything in that process towards the end to make them better. and it doesn't happen. And it's usually quite a stressful time because we're throwing everything, it's an acute situation. You're doing everything, pumping in this, doing that, and then it ends up that they're gone.
Yeah.
And it's deflating and it's sad. But at the same time, I haven't then now at the stage I am kind of gone, I might ask God why. And I think that's okay to ask God why.
Absolutely.
Whether he answers you or not is another matter, or whether you hear the answer is another matter. But I might ask him why, but I don't let that take away from my faith. And I don't let that kind of diminish who I think God is in my eyes. Like it doesn't look like, oh, God hasn't done it or God has failed. I just don't know why. And I've come to accept that I won't know why. There's some things I won't understand, but my job is to hopefully do what he sends me there to do. And that's how I look at it, because I'm not, if not, then I kind of sometimes you might think, okay, I'm all powerful. I'll go and make sure everybody is healed while on this thing. I always pray though. I pray that people don't get worse on my shifts. I pray that people don't die on my shifts, So I still keep that faith. But if it doesn't go well, I kind of accept that it's beyond my control. It's not something that I can do anything about. Yeah. But is there a learning there for me? Is there something that I need to take away? Is there something that I need to learn? Also, you don't know the context of the family. You don't know what God is doing in those people's lives. It's not all about me. Yes, I'm the child of God that's there, but I don't know what their beliefs are as well. So it's difficult because I don't think that I can say, oh, that's fine, and just be like, yeah, okay, that's fine. You feel the hurt. You see parents cry because of a loss, and it really, you get pain, especially as a parent. You get pain, and you think, gosh, if you're in that situation, how would you handle it? So it's definitely very emotional, but at the same time, what I've tried to learn is that, God, he is God, he is sovereign, and I don't know all about his ways, yet. So, that's how I approach it, really.
That's powerful.
Honestly.
That's powerful. I think one of the things I would just say is I was listening recently to a podcast where the guy was saying that many people question God for the wrong reasons. Because whether he chooses to speak or not, it doesn't change who he is. I think many of us go in asking because we were hoping to change the outcome.
Yeah.
But it's rather understanding that even when he's quiet, his will is ultimate. And that even when he chooses to speak, is that we're learning, not because we're questioning. Yeah. And I thought about, I was like, oh my God, that's crazy.
Wow. But I think the other the thing for me as well is believing that God is good no matter what.
Yes.
So, whether, he's speaking or he's not speaking, it's actually knowing that he is good no matter what.
He's a good God. Yeah.
And, he has plans for us. The Bible says his plans for us are to prosper us.
Yeah.
So we know that he's good. We know that he wants the best for us. What we can't understand are some of these challenges, but it doesn't mean that at the end of the day, God, doesn't, he is good. And I think somebody I think it was on the radio or something where I think so. It was a lady who came and talked about suffering and how she'd gone to, God saying, look, these people are suffering. Why are they really suffering? And then God gave her a vision of the people that she had seen suffering, but Jesus within those people and actually holding those people and weeping with those people. And she said she then understood that if you feel you're hurt by what that situation is, imagine that God actually he is hurt even more by what is going on. That your hurt is nothing compared to how he feels of his children suffering. What we don't understand is we want the magic. Just put out your hand then and wake them up, or put out your hand then. You have the power to do so.
Yeah.
But that's why he is God. Otherwise, if we knew everything, where would we be? Yeah,
absolutely. Wow. That's profound, actually, because I've never really thought about suffering from, or human suffering from, God's lens. Because you only think of it from the suffering of the people,
the person,
us as human beings. Even if it's not the person themselves, is the people around them who will have to, live with the grief that person has, that person is lost, etc. I've never really thought about it from how God feels about us suffering. And wow. I think on that note, I think this is
a lot to unpack.
I think that's the right place to sort
I've
of
really enjoyed
leave off
this. I've really enjoyed this
episode.
conversation. I really have.
Indeed.
It's been interesting. Thank you so much, Michelle.
No, thank you. Thank you
for your
having
time.
me. For wanting to have me.
Drag you back here because it's been such an insightful conversation, a lot of learning. I think one thing that I would take out of this is when you were talking about your journey and how you got, from your training. And I think sometimes having awareness of something, but then I think for me, what I found powerful is how you said, I know who I am, and how that has defined your journey into this whole space that you find yourself in. And I just find that really admirable. And, that's something I'll definitely take into my day-to-day.
And give your daughter her medicine.
I will.
Yeah.
I am.
Give her the medication.
I am. If you ask her,
Michelle is watching you.
She'll tell you.
She's watching
Come and check. I'll count all the pills that are left.
Know what? Every month you gotta count it.
Come and count it.
I will. I'm doing better. Thank you so much. Thank you.
Thank you so much for coming, guys. I'm sure you've enjoyed this episode as much as we have. Let us know, what is your biggest takeaway from this episode? For me, there's been a lot. My mind has been blown. Please don't forget to like, share, subscribe.
Please.
And until next time, see you on the next one.
Yeah.